And we're back on the Monday before Christmas, and we have the fortunality of having Chuck on the phone. Chuck.
Hi, Doc. Can't believe I beat the flag man, but...
Yeah, I hope he's okay, because he's usually a regular caller. So
yeah, I'll call him after the show. I always do. Anyway, I'm kind of the poster boy for heart problems, and there was a article today that I found very interesting about sudden cardiac arrest, which kind of fits with blood pressure, etc. Anyway, it was done out of Portland, Oregon, and it said of the 350,000 deaths a year from sudden heart attacks, arrhythmia, and things like that, not blockages.
Mm-hmm.
It said that as many as 90% or more die of it because they don't recognize their symptoms. And the symptoms they found through the study may happen as much as a month ahead. And for me personally, if I hadn't learned to recognize my own symptoms, there's no way I would have been alive today.
Mm-hmm.
So I know how important it is, and I thought it was a very interesting article. And as it said in the article, it's kind of surprising these studies haven't been done before, and enough attention's been paid to it. So I'll leave it with you on that one.
What were the symptoms that they were talking about?
Basically, and this is my key symptom, they were talking about don't ignore the possible signs of trouble just because you think they're indigestion. And then it said chest pain, shortness of breath. Those are the things that should come to you, that should come to you in the middle of the night and get to the emergency ward and have it checked out.
Mm-hmm.
And then it said, let me find it. Okay, for most, the symptoms begin within 24 hours of their collapse, although some come a week before and up to a month. Chest pain was the most common in men, while women were more likely to experience shortness of breath. Other symptoms include fainting and heart palpitations. Now, with me, I had a lot of pain in my back also, but that was due to the location of the blockage.
Mm-hmm.
So anyway, I'll leave it with you unless you got something else.
Okay, well, we'll talk a little bit about that. Those are very good. Subjects, and certainly along the line of what I was talking about is certainly checking your blood pressure on a regular point to make sure, because one of the responses to running high blood pressure is that the heart muscle will thicken, and a thick heart muscle is harder to feed. And when God created your blood vessels in your heart, He had your heart feed from the outside in. So if you have a muscle this thick, and basically, and it thickens over time. It's like any muscle. If I'm doing bicep exercises, and my biceps are gonna increase in muscle hypertrophy, and the muscle and the heart does the same thing. So, and the only time the heart gets fed is in diastole, or when the heart is at rest. When the muscle is contracted, it squeezes off all the blood flow going into the heart, and when it opens up, the muscles relax and blood comes from the outside into the heart and feeds it, and then it contracts again and relaxes. So anything that thickens the heart muscle will basically decrease the amount of food that the heart can receive. And it's like any muscle. Any muscle that doesn't get enough oxygen will cramp under activity. So if you're running or walking and your legs are cramping or things of that nature, that's a natural response to a lack of blood flow. So chest pain, and in that sense, some people will feel it in the left arm. And the reason the heart is felt in the left arm is because when we're in embryo, the heart pulls down from the left side into the chest. So we have the nerve roots that from our heart are actually pulled in. So that's why when we have heart pain, we'll feel it in the left side of our arm. And chest pressure can do that. Now, the interesting thing about chest pain at night or any particular time is that GERD, or gastroesophageal reflux disease, can cause irritation of the esophagus. You cannot tell the difference between angina and esophageal pain. And in fact, if you were to take nitro for your chest pain and you were having esophageal spasm, it would relieve it. So therefore, the two are indiscriminate. The good news is that esophageal spasm will not kill you. And the bad news is, if it's heart, it will. So as a medical provider, we are obligated to play out the worst scenario. So even if you have indigestion, and why would you have indigestion if you had heart pain after you eat? Well, again, it could be reflux, but at the same time, it could be the fact that all of your blood flows down to your splanchnic bed or your abdominal cavities to pick up the nutrients that you just ingested. And in doing so, it might take away from your heart. Also, after eating, your blood pressure goes up because insulin drives blood pressure and things of that nature. So you have two reasons to have chest pain, what we call postprandial after eating chest pain. So those are reliable signs that you might be having some what we call ischemia, or lack of blood flow to the heart. And listen, any male over the age of 45, especially if you have any family history and if you have any risk factors, are certainly at risk for cardiac disease. And if you have any chest pain when any of those situations, if you smoke or you're doing anything that revolves that, then you gotta understand the obvious, that this might be my heart and I need to make sure that it is not. If not, then you are at risk for sudden death. Well, how does sudden death occur in a heart? Well, if your muscle were to thicken enough and you get part of that muscle dies, then it cannot be alive and send an aberrant or a aberrant electrical pulse through the heart and set off a discharge, and your heart could go into an abnormal rhythm and not being able to beat. And the other part of that would be if your heart has a blockage high in the arterial system that feeds the heart, then that could wipe out the entire muscle and you would die from cardiac arrest. So I'm going to interrupt that thought for a minute because we have Red on the phone. Red?
Yeah.
Doug, thank you for calling.
Oh, thanks for taking my question.
Yep.
I was curious about. I recently chose hospice for my cancer, and there seemed to be some confusion about. I was taken off my psych meds. Is that normally part of the way it goes with hospice, or how does that correlate between your psych meds and your medical meds once you go hospice?
Well, hold on a second because I'm having a hard time. Let me have my producer maybe come in and adjust the volume on the question so that I can maybe hear you a little bit better. It's one of the things.
Something about hospice and psych meds?
Yeah, well, I just tell me again what your question was.
After making the decision to go hospice for cancer, and I know that a lot of the old medications and treatments are dropped, but I was wondering how that works with your psych meds.
Okay, so if I understand the question, then you're worried about some of the medicines being dropped when you're on hospice, but the psych meds maybe not be dropped. Is that kind of, or you were curious about psych?
Yes, they did take my psych meds, and I'm a little worried about it.
Okay, so normally hospice is related to the terminal diagnosis and pain and suffering. So mental conditions, be depression, any type of psychological disturbances, illnesses should be treated as a part of the hospice protocol, because your mental psyche and how you interpret pain and how you deal with your illness and how you deal with the terminality of your life are all very important issues. So those things, it's been my understanding in my practice as a medical director of the hospice, we try to maintain people on all psychiatric medications, and we also want to make sure that they're covering their depression medications or other things of that nature. There should be some counselors involved, some social workers in your hospice that might be able to help you with those if that's what's needed. But I'm hoping I'm answering the question correctly, but it is important that they continue all psychiatric medications with your hospice participation.
Okay, great. Yeah, I think that answers it. And thank you very much. That was very helpful.
And if they don't, Red, then it's time for you to look for another hospice. There are a lot of them in the area. Okay, so
okay.
But If they're not covering your psych meds, that's a problem, okay?
Right. Oh, okay. Thank you very much. You've been a big help.
You're welcome. You have a great night and a good rest of the year.
Yeah. Hope I got that much time left. Thank you.
Well, thank you very much for calling in. Good question. And back to the heart issue. So again, interpreting those situations and looking honestly at your risk factors for heart disease are very, very important. So one of the things we talked about as I started the show, taking some positive steps in your health going forward, and that would be maybe getting your cholesterol checked, looking at that, even though that's not the whole picture, maybe even getting a general physical examination. And you know, there's no excuse anymore if you don't have health insurance and you're poor. Medicaid is now available. I don't want to be a spokesman for Obamacare, but it actually has worked for a lot of people who do not have the money, and Medicaid is available. You know, you have to swallow sometimes your false pride and understand that times are not easy and times are tough. So it's very important that you do that. Ray, I thought you had dropped off the face of the earth. Ray, are you there?
Yeah, I'm here.
Okay, good.
Hey, you doing a whole show tonight, or are you going to leave after the half hour? What are you doing, Doc? Come on.
Oh, well, you know, if we get callers, I might stay, but I got a plane to catch later tonight, so I got some things I got to do. But
So if you missed the plane, you're going to blame the flagman. Is that what it's all
no,
about?
I'm glad you called. I was just curious why you weren't the first caller. Usually you are to start the show off right.
I was interested in the way you were explaining the blood pressure, and I just wanted to make sure I got it.
Okay.
So I didn't want to, be on hold waiting or whatever.
Yeah.
Two things. I used to have a TV show about 7, 8 years ago called Louie and the Flagman. Louie and the Canio and I had a show, and I always used to preach the healing power of the pup. And when people have an animal, a dog or a cat, somehow it helps the blood pressure, lowers the blood pressure when you're taking care of this animal.
Absolutely.
The second thing was as far as self-hypnosis.
Yep.
I used to practice that quite a bit. I should do more of it now.
Mm-hmm.
If you can comment on either one of those or both of those, I'd appreciate it because it would help a lot of people out. It really would.
Yep, I will. And then we're going to be going to break here in a minute, so you'll keep me over, which I don't mind. So.
All right. I'm glad I called then.
Yeah, you called at the right time.
You do,
Strategically placed call, Ray.
Keep the faith. Have a good night.
Yep. All right. So we're going to go to break here in a minute, and I will bring up and answer Ray's questions. And pet, what's that? Okay. So Ray's talked about pet therapy. Pet therapy is one of those things that is very, very useful. There's something very calming about an animal. There's probably very calming about the love situation that develops between you and your animal, and animals are very attached to their owner, and there's this communication level that takes place, and when that happens, people do find that they forget about their worries, they forget about the world around them, and what's going on in their life, and they're focused on this relationship between themselves and this pet. I know they used to bring pets into the hospice that I worked in, and they call it obviously pet therapy. So, and you should do that to yourself. We're going to go to break, and we'll come back and we'll talk a little bit about pet therapy and the other topic that Ray brought up. Thanks for tuning in.